Good day, everyone. Today we will explore pancreatitis, a significant medical condition involving inflammation of the pancreas. This lecture will cover the anatomy and the function of the pancreas, the type and the causes of pancreatitis, its clinical presentation, diagnostics, diagnostic approaches, treatment strategy, and potential complication. So by the end of this video, you will have a thorough understanding of this condition and its implication for patient care. So let's start with the anatomy and the function of the pancreas. The pancreas is a glandular organ located in the retroperitoneal space of the abdomen behind the stomach. It measures approximately 6 to 10 inches in length and has both exocrine and endocrine functions. The exocrine pancreas comprises of 95% of its mass, producing digestive enzymes such as amylase, lipase, and proteases, which are secreted in the duodenum via the pancreatic ducts to aid in the digestion of carbohydrates, fats, and protein. The endocrine pancreas consists of the insulate of Ligand, which releases hormones like insulin and glucagon into the bloodstream to regulate blood sugar levels. However, its anatomical position and the potency of digestive enzymes can also make it vulnerable to self-damage, which is central to pathophysiology of the pancreas. Now let's move over to the definition and the type of pancreatitis. Pancreatitis is defined as the inflammation of the pancreas, which can occur in two primary forms, acute and chronic. For acute pancreatitis, it is a sudden, often irreversible inflammation of the pancreas. It ranges from mild, self-limiting cases to severe and then life-threatening conditions with systemic complications. Acute pancreatitis is typically a one-time event but can actually reoccur if underlying causes are not addressed. While for chronic pancreatitis, this is a progressive, irreversible inflammatory process leading to permanent structural damage and loss of the pancreatic function. It often develops following repeated episodes of acute pancreatitis or due to long-term insults to the pancreas. Now, both types share common etiologies, but they differ in clinical cause, management, and long-term outcomes. Now let's move over to the causes and the risk factors of pancreatitis. The causes of pancreatitis are actually diverse, but two stand out as the most common, which is the gallstones and alcohol consumption. Now for gallstones, in acute pancreatitis, gallstones are the leading cause, particularly in women. A gallstone can obstruct the pancreatic duct, causing a backup of digestive enzyme, which then activates prematurely in the pancreas, leading to autodigestion and inflammation. While alcohol, on the other hand, which is chronic alcohol abuse, is the primary cause of chronic pancreatitis and a significant contributor to acute cases, especially in men. Alcohol-induced toxicity damages pancreatic acinar cells and it actually disrupts the enzyme secretion. Now, other risk factors include smoking, obesity, a family history of pancreatitis disease. So, understanding the etiology is critical for tailoring treatment and preventing reoccurrence. So, let's move over to the next section of this video, which is the pathophysiology. The hallmark of pancreatitis is the inappropriate activation of pancreatic enzymes. Normally, digestive enzymes are secreted in an inactive form and are activated only in the duodenum. In pancreatitis, triggers like duct obstruction or alcohol toxicity causes premature enzyme activation within the pancreas. Trypsin, which is a key enzyme, activates other processes leading to autodigestion of the pancreatic tissues. This triggers an inflammatory cascade, releasing cytokines and causing local tissue damage like edema and potential necrosis. In severe acute pancreatitis, systemic inflammatory response syndrome, which is SIRS, can develop, leading to a multi-organ dysfunction. So chronic pancreatitis, on the other hand, results in fibrosis, loss of functional pancreatic tissue, and complications like endocrine and endocrine insufficiency. Now, another part of this video which is very important is the clinical presentation. The clinical features of pancreatitis vary by type and severity. The hallmark symptom is epigastric abdominal pain, often radiating to the back, described as severe, constant, and worst after eating. Patients may present with nausea, vomiting, fever, and tachycardia. In severe cases, signs like the colon sign or the great tunnel sign may indicate retroperitoneal hemorrhage. Now, physical examination may reveal abdominal tenderness and distension. Now, for chronic pancreatitis, patients often experience chronic epigastric pain, which may be less severe but actually persistent. Other symptoms may include weight loss, steatorrhea, which is due to fat malabsorption from the endocrine insufficiency, and diabetes mellitus, which is from the endocrine dysfunction, which we have talked about before when we talked about how the endocrine function of the pancreas is releasing the insulin and glucagon, maintaining the body's sugar level, and a dysfunction can lead to diabetes mellitus. And also the pain may also worsen with meals and alcohol consumption. So now let's talk about one of the most important part of the video, which is diagnosis. Diagnosing pancreatitis relies on a combination of clinical, laboratory, and imaging finding.